Okay.
Hello, so Chase is going to be a really good boy for us for this video. So here is Chase's feeding tube. We've got a stopper here which just prevents air going down the tube while you're preparing the food. And that can just be released by unclipping it. And then we've got the end of the tube which has a stopper to protect it in between feeds. So the first thing we're going to do is show you how to take the bandage off and check the wound around where the tube has been inserted. So it's helpful to have somebody holding Chase and another person doing the bandage. So you want to find the end of the bandage, or you can just gently tear at it and it peels off very easily and it doesn't hurt. We then got a bit of soft bandage underneath, which we'll just unwrap as well. Good boy, Chase. Well done, mister. So underneath the bandaging material, we have got a little sticky dressing which just helps hold everything in place quite nicely. So the edges of this can get a little bit sticky, just like with a plaster on ourselves. So what can be quite handy is if you get a little bit of cotton wool and you just wet it with a little bit of water and you just wet and dampen down the sticky edges around the dressing. And then you can gently peel the dressing off. As long as you're nice and gentle, this shouldn't cause any pain. Now, there's a little bit of discharge on the dressing there. That's normal and it doesn't smell, and that's just what we would expect to see on a daily basis every time you clean it. If you notice that it's green or it smells and is yellow, then let us know. But Chase is on antibiotics anyway to try and prevent any infection at the site, so we shouldn't really run into any problems. The next thing we'll need to do is just gently bring Chase's neck back and have a look around the site. It's looking very nice and calm. There's no redness or puffiness, and he's not reacting to us gently pressing around it. So usually if there's discharge around there, you can just give it a clean with some cotton wool and water, but there's nothing to clean off there, so I'm not going to risk irritating that site. In terms of rebandaging it, we're going to supply you with something called Primapore, which is the little sticky dressing. So when you open it up, there's some plastic to peel off, but before we do that, it's helpful just to make a slit halfway along with some scissors. And that way, when you do stick it, you can put the feeding tube in between and then it sits nicely in place and stays on much better. Peel the dressing back when you're ready. And then put the slit in between the tube and stick it down around as much as possible. It can be a little bit awkward, but as long as it sticks to the fluff, the fur or the skin, you're not going to go too far wrong. And then the important thing really with the bandage is to make sure that you don't do it too tight. So you want to put one strand next to the left side of the feeding tube and another strand next to the right side of the feeding tube so that it stays snugly in place. So I'm just going to gently lift Chase's neck up. Good boy. Good boy, mister. So we've gone round once on the left and then we come round on the right. Sorry, I think I have my left and rights mixed up doing this upside down, but I'm sure you understand what I mean. And the whole time we just want to check we can get 2 fingers underneath. So it's just a very light dressing without putting any pressure. And this just can be easily torn off at the top. And then the more secure part to the dressing is this, we call it vet wrap. And you want to do exactly the same, and at the same time making sure you can keep 2 fingers underneath the bandage. Good boy. It's easier to use scissors to cut that off when it's new. So now that we've checked the feeding tube where it's gone in, we can move on to the feeding side of things. So we're going to supply you with a food called Convalescence, and it's a powdered formula, and 1 sachet needs to go into 150 ml of warm tap water, or boiling water that's cooled down, and you put you can do it in a kitchen feeding jug and make it up and keep it in the fridge in between feeds. You want to mix it quite well so it all dissolves and it will turn into a sort of a milkshake, which we've got some already prepared here. So you just want to mix it before feeding. So we've got the food ready to go, but it's really important that we make sure that the feeding tube is in the right place before we attempt to put any food down. So we're going to supply you with an empty syringe, which when you pull back on the plunger, you can push it back in. So this is going to be for checking that the tube is still in the esophagus and it's not gone anywhere it shouldn't. So the main place we don't want it to go is into the lungs. So what we're going to do is release the white clip, and then we're going to take the top off the feeding tube and put this syringe with the plunger at the bottom into the tube, and then pull back on it. And what you want to find is that when you're pulling back on it, there's negative pressure and the syringe plunger is trying to go back to the bottom of the syringe. If you find that you're pulling all the way back and there's no negative pressure, then stop it and let us know straight away. So once you've done that, you then want to use some tap water just to very gently trickle down into the tube and clear away any food that may have blocked the tube up. So when you press the plunger on the syringe, you probably want to give 5 ml or so over about 2 minutes. So I'm just going to trickle a little bit in to show you, but you'll obviously want to do a little bit more when you feed him. So just very, very controlled, trickling it in, and you should find that it goes in very nice and easily. If there's any resistance on the plunger, then let us know at the first time that you notice that. So when you put anything through the tube, you should find that Chase doesn't react at all. So that means that it should be in the right place as well, and that it's going into the stomach where we want it to go. If he starts to splutter or cough or seem very uncomfortable, then again give us a call. So once we've flushed it with some water, we can then move on to the food, which we're going to supply you with some syringes to suck up that milkshake food with. And then again, you want to put the syringe on the end of the tube. Hey, mister. Hey, you good boy. And again, over very slowly, you want to administer the food. So he's at the moment per feed, he's having about 33 millilitres, and you want the whole feeding process to take about 15 to 20 minutes so that it's nice and slowly, and we're not going to overload his tummy with the food. So again, you just want very controlled feeding and pressing the plunger. And again, there shouldn't be too much resistance, but there'll be a little bit more resistance with this than the water because it is thicker. But again, Chase moving like this is absolutely fine, but any signs of distress or discomfort, then you just stop it. After you've given the 33 ml by the feeding tube, you want to flush it with some more tap water. So again, you just change the syringe to the one with the water and flush it through with about 5 ml or so. And then at the end, you just want to put the top back on the feeding tube, and it's just been sitting sort of on Chase's side, but if you notice that he's a bit more mobile at home, which he probably will be, you can just use a little bit of sellotape or something just to attach it to the bandage, just to make things a little bit more comfortable. Occasionally these can wear with time, so again you can just put a little bit of sellotape over the top in between feedings to make it easier. And then the last thing you want to do is just click the stopper so that we prevent any air going in if this does ping open. And that's pretty much it. He's been really, really good for this, so I'm sure he'll be really good for you at home. So hopefully you'll get on well with that over the weekend.